Excited about all the activity that's going on, and I mentioned this energy bill. Please don't miss that story. There's, whether it's education, whether it's healthcare, whether it's the energy, whether it is the area of cleaning up the government. There's so many things that are going on, unlike anything we've seen before, and it's the wild animal bill. I mean, there's so many things moving through that it's really exciting. And I think initially the legislature was like overwhelmed with all this stuff. Now I think they're more and more comfortable, and it's a lot of progress. I'm really happy today about things.
How committed are you to this separate bill now that would require drug testing for certain?
Let me talk a little bit about that. My reaction to those who find themselves unemployed, okay, so you go home and you tell the family, I lost my job today. And the idea that we were going to tell them, okay, now you got to go take a urine test, on top of all that, I didn't like that idea. When you talk about people who now are on welfare, and I saw some of the stories, and I've been very careful on this issue because I'm sensitive to it, sensitive to what this is all about. You can't have people on welfare who have children around who are on drugs. I mean, you just can't do that. And when somebody says this is an attack on the poor, I frankly, I don't get that. What this is this is not about, first of all, the public does pay the benefit. But secondly, we want the person who might be on the drugs to get off the drugs. Just ignoring the issue, because we have a major drug problem. First of all, if you want to go to work in the state of Ohio, you take a drug test. If you want to go work in the private sector, you take a drug test. What my concern about this is, and I think the bill was improved, and I haven't studied the bill, but the bill was improved from the standpoint, if you can find a person that can make sure that the family doesn't get cut off. I mean, I've been looking at this for 6 months, and then the issue gets to be, if somebody is on the drugs, we're going to have to treat them. So it's good for the person to get them off these drugs. I'm pleased that they're going to do this separately, because we've got to look at what it all means. Now, there have been the notion that, we're going to pound our fist and, I'm not going to pay any money to anybody on drugs. That's not where I'm coming from on this. I come from it from 2 points of view. It's not fair to taxpayers, and they don't want their money to be used to give welfare money to somebody who could be using it to buy drugs, okay? So that's not good. On the other hand, you can't just take people off and walk away. The pilot project concept makes sense to me. And I'm glad they're going to spend their time and look at it. We're willing to work at them. We should look at what other states have done. But this is in no way, shape, or form, in my opinion at least, from my perspective, some punitive kind of, we're going to club you over the head. I want people to get off these drugs. And so we'll see how it all works out. Does that make sense to you?
Yeah. Another question.
But the notion that, kick them off, that's not where I am on this. It's different than that. So, but I think we have to think about it. Then the question gets to be the cost of this treatment. It's staggering. It's staggering numbers. So we got to figure out better ways to treat. I was supposed to have a meeting with Orman and Bonnie Cantor and Wimslow and Greg Moody, and they'll be involved in this. In the legislature, I think, is going to look at this in some sort of hearings, which I think is good. And let's get everybody in there. But the initial reaction from people who are advocates of the poor, that this is picking or this is a targeting, I think it's an overreaction, and we'd like them to work with us, because they don't want people to be on drugs who are on welfare. Who the heck does? Nobody does. But this brings up an even broader question about what are we doing with all this drug treatment? And what are we, it's just a very difficult problem. If you talk to employers, many of them will tell you, I can't get qualified workers because nobody will pass a drug test. Go and talk to people out there, and they'll tell you this. Now, I don't know how much of it is hyperbole and how much of it is real, but it's clearly a problem, and not just in Ohio. So that's kind of what my feeling is about.